Good morning, everybody, and thank you so much for joining us today. This was a very large registration. Over 250 people registered to be a part of this webinar. Like many of you, I am sure we are all very concerned about what is happening around COVID-19, and so I'm very excited to have our guest today. But before we do that, we're going to do a little technical assistance. On the right-hand side of your screen, you're going to see something that says Go to Webinar Control Panel. If you look at that, there's a little arrow next to a thing called Questions. If you could click it so that the arrow is pointing down, what I'd like you to do is if you could put your name and your city, and if you're working at an agency, where you're working, so that we could know some of the people who are on the call. As I was mentioning earlier, you know, there are, I think, so many questions that all of us have, both personally as well as for people living with HIV, as well as for our organizations. And at the end of this webinar, so there'll be about 30 minutes of a presentation, and then at the end of the webinar, we will go to and do a 30-minute section of live questions and answers. Part of why we're having you use this question box is that, unfortunately, because of the numbers, we're not able to open it up to everybody. And so you'll have to type your questions in the question box. When you do that, what we would like you to do is also put your name so that we could identify who the question is coming from. So Chip, who's on the webinar today?
Sure, so we have Florence Holmes from SJAA. We have Mary Miller from Tucson, Arizona, the University of Arizona. We have Julietta Geiner from Durham, North Carolina, Duke University Pediatric Infectious Diseases. We have Robert Lord Shell from South Jersey AIDS Alliance. Paige Castro-Raiz, Kashmir, Washington, Community Campus Partnerships for Health. Heather Peters from Charleston, South Carolina, Ryan White Wellness Center. Babette Richter, RN, South Jersey AIDS Alliance. Derek Robinson from Panama City, Florida. Mitchell Warren from AVAC in New York. Mario Schauer from Miami, Florida, Allied Health Organization, and a lot more. We currently have almost 100 people on right now. So,
well, thank you all so much for joining us. We really appreciate you being here. And I think that the interest in this topic is really about the interest in kind of our own lives. Stefan, I want to thank you for joining us. And rather than take time to read your bio, I will do this. I will ask everyone to look at our email, and I'm just going to turn it over to you because people really want to hear you. They don't want to hear me. And so thank you so much for joining us, and I look forward to listening to your presentation.
Awesome. Thank you. Thank you, Paul and the organizers for the opportunity to talk to you all today about this very important topic. I'm going to go ahead and start. So hopefully you can see my slides. So I want to really talk about.
We can't see it yet.
Stefan?
Yes, can you see them?
No.
Okay, how about now?
Yes.
Okay, perfect. So my name is Stefan Wallace, and I am the Director of External Relations for the HIV Vaccine Trials Network and the COVID-19 Prevention Network. And I'm going to do an overview of Inequalities as well as the network to provide some information, and hopefully we can take some questions at the end. So a bit about the inequities in terms of COVID. What we know is that people of color are indeed overrepresented in COVID, and that folks who are a part of the essential workforce, folks who typically have less or diminished access to healthcare options, work from home options, and other benefits, are disparately impacted by COVID. And residential segregation plays a key role in this as well, because households that have more members, particularly multi-generation households, are at elevated risk as well. Increased risk of chronic stress, and that structural racism, violence, everyday aggressions increases the stress associated with this, and that people experience. And these are all a part of sort of the symptomologies or experiences that many people really experience in this country because of systems of oppression. And these are also seen with respect to COVID risk as well. Let's see if I can make this work. So what we're seeing in terms of cases, none of this information may be new, or some of this information may be new for some folks, but again, Black and Latinx persons are at increased risk for COVID for lots of reasons connected to structural racism and oppression, and that the cases reflect this. We're seeing higher cases per 10,000 people in Black and Latinx communities. And this is as of July 5th.
Stefan, your PowerPoint isn't moving forward.
It's not moving forward. Okay.
There we go. Thank you.
Okay. I will try to do it from here. So the cases per 10,000 people by age, you can also see that with race and ethnic origin and background, there's also an impact that you will see based on age, and that the older a person is, it looks like the more likely they are to be at risk and to be susceptible to COVID or the coronavirus. So this is something that's important to us as well. So we're looking at, again, ethnic and racial groups. We're looking at age. As you can see there, folks who are over 50 bear a greater proportion of those that are impacted, particularly if they're Black or Latin. So CDC cases by race and ethnicity, again, I sort of talked about this a bit, but just in this sort of form, I just want to highlight again that Black and Latinx persons are disparately impacted by this based on their population size. And we can see here as well for associated hospitalizations by race and ethnicity, we see those same disparities exist. In terms of deaths, this carries over as well. We see Latinx and Black persons, Asian, non-Hispanic persons impacted significantly by death. And with this chart, you will note that there's a large concentration of specific groups that are impacted based on geography. A lot of this has to do with not just urban centers, but also rural areas where lack of access to support and resources, services, as well as population density. So it's not just an urban or a rural thing. This is sort of a potential for everyone, and this was as of July 5th. So in terms of Black and Latin cases, just in comparison to persons who are white, again, this chart just illustrates that this is a clear disparity that we're seeing, and this data comes from the CDC. And I want to just contextualize that communities that are hardest hit for other chronic conditions and other systemic social cultural challenges are also impacted by COVID-19. And these social and structural inequities are present and impact people across the health lifespan. And so it's not just COVID. And even when we think about HIV, it's not just HIV as well. And that we need to do a lot of work to ensure communities understand and have access to information in order to support their understanding, and that we continue to work to support research and partnerships with communities in response to COVID-19, and not just in a clinical trial perspective, but also in a point of care perspective. that we also need to ensure that we're promoting and really looking at equitable representation of communities and COVID trials. And this commentary comes from colleagues Stevenson and Basola out of Massachusetts. So a little bit about the COVID Prevention Network now. Our objective is really to, at this point, test 5 different vaccine candidates over the course of the next 6 months or so, and to find one or more that will be effective. We're working in partnership with lots of different folks to do this, and these trials are primarily being spearheaded by pharma, the different pharmaceutical companies that are producing these products. And we need to respond to this pandemic. The numbers that are listed here, will continue to rise without an effective vaccine and prevention modality. And part of the work that we're also doing is in the monoclonal arm. And so it's not just a vaccine initiative, it's not just a vaccine program, there's also a monoclonal antibody program as well. So how we think about rolling all of this out is by harmonizing our model across all of these different trials. And this is a collaborative effort of the CoVPN, which is comprised of many partners, as well as folks in BARDA and US military, pharmaceutical companies, and US government, in order to harmonize how we implement these studies and the laboratory and data safety and monitoring aspects that support it. And this will allow us to be able to see and look at whether there's an effect more rapidly, as well as get these trials out and into communities rapidly. So this is truly a collaborative effort on the part of many stakeholders to do this work in order to effectively respond to this pandemic. Each of the trial structures will include individualized informed consent processes. All of the trials will be randomized, and the injection visits will be either with a vaccine or placebo, or in the case of the monoclonal antibodies, it will be a monoclonal antibody or placebo. Sites will follow up with participants and check for symptoms. Folks who may test, who are interested in testing, if they're interested in testing because they think they might have a symptom or might have been exposed, they can come into the clinic for this testing. And if they test positive, they can be encouraged to quarantine and follow up with the clinic staff on a daily basis to ensure that we're checking for their health. Safety is really important in these studies, and this is important not just to us at the CoVPN, but to everyone who is involved. And blood draws will be taken in order to look for the presence of an immune response. And we can expect that these studies will last about 18 months, including the enrollment period plus the follow-up period. So we're looking at about 30,000 persons for each of these studies. And this is significant because this will, in addition to being a massive endeavor to enroll, this will also support getting to an answer quicker. So I think that this is a really important piece to sort of mention. I know that there will probably be questions about it. So these are where the CoVPN trial sites are located. This map represents the sites that are affiliated with the HIV Vaccine Trials Network, the HIV Prevention Trials Network, and the AIDS Clinical Trials Group. The site map does not represent, the list of sites for all of the studies or for any one particular study, as the pharmaceutical partners that are working with us on these studies will also bring in sites as well. So this is an updated product pipeline. As you can see, we have 5 vaccine studies that we're looking to roll out. And the first being Moderna, AstraZeneca, Janssen, Novavax, and then Sanofi. And so you can see the enrollment period there, and then the follow-up period, of course, lasting quite a bit longer. So regarding community and stakeholder engagement, again, there's quite a few folks who are working on all of this, including on the community engagement side. This is a list of many of the folks who are part of this process, and their representative organizational affiliations on the right. And again, there's representation in this group from the HIV Prevention Trials Network, as well as the HIV Vaccine Trials Network, as well as the Hank Legacy Project, the Office of HIV/AIDS Network Coordination. So there's a lot of folks who are engaged in this process and want to see it successful. So there are a couple of tiers of these activities that we're going to be doing for community engagement. We're producing materials for participants and potential participants that include community education slides that will provide an overview of COVID-19 and also provide an overview of that particular study. The website and the registry, which has been launched, many people have seen it already. I think as of my recent check, there was about 70,000 plus persons who had registered on the website. We're also contracting with some communication specialists to do very specific and focused communication ads and digital marketing for Latinx and African American populations, and in particular, persons who are undocumented. We're also producing materials for sites, and these will be standardized tools that will work to support community engagement at the site level. This will include best practices and great ideas. We've been having meetings with stakeholders and community staff and CAB members to really talk about, really talk about what is needed, what is necessary, how do we move forward with recruitment and education for COVID-19 and for some of these trials. So we've put together a list of best practices and great ideas based on those conversations, and that information has been provided to the trial sites. We've also collected community engagement work plans that outline some of the education and recruitment strategies that sites plan to undertake in response to some of this work. There's an FAQ document that briefly explains the highlights of the studies and what we're trying to do. There's an inequities slide, some of that information you've seen here in this presentation. General education and recruitment materials that we typically produce, posters, flyers, palm cards, as such. And these items will be provided to sites so that they can use them digitally, or they can print them out and have them hanging up as well. And of course, site training, preparation and QA calls. So providing site support through this process, not just sort of at the onset of enrolling or opening a trial, but throughout the duration of the studies and post. This slide is an example of one of the education slides, which shows some of the different groups associated with a particular study, and how a person might be in one group at the beginning of the study and transition to a different group, or remain in the same group by the end of the study. So this is just an example of one of the slides in our education slide deck that has been useful to communicate how a person might move through the process. Convening expert panels to look at engagement and ethic considerations with respect to different populations that are key interest for us, including Native Indigenous communities, African American, Black communities, Latinx, older adults. And these groups are going to be convened and have an opportunity to provide feedback to us regarding the studies. We have also convened community groups, community working groups, which is a sort of typical part of our process with the HIV Vaccine Trials Network and the HIV Prevention Trials Network, and utilizing this mechanism in order to support information sharing and lessons learned, best practices, and also to do some troubleshooting around community engagement at the site level and at the operations center level. And then there is stakeholder engagement broadly. And so, thinking about how we build trust and how we do sort of the broader engagement beyond the clinical trial sites, doing community listening sessions, town halls and webinars. We've already collaborated on a town hall with an advocacy group recently, and have several plans to do webinars in the future with many groups, including MMAC, and give the opportunity to provide not just an overview of the co-VPN and what we're planning to do with the studies, but also to come back, to come back to you all and to the other groups to provide updates as well. So we're looking at trade unions. This is not an all-inclusive list. Engaging trade unions and providing them with information and giving them information, and also working with them to get information out to their communities, grassroots organizations, and again, this is not an all-inclusive list, Thrive SS and BYP 100, and national organizations, not an all-inclusive list, some ones that are there, AARP, NAACP, and Urban League, and then political entities, again, not an all-inclusive list. And really the goal here is to blanket communities with information that will help support community education around what all of this is and what all of it means. And part of the work is really to support this education. And I think this is really a priority because in our model, in our work, we believe that education is necessary to support recruitment and support community partnerships and meaningful engagement and involvement by communities in clinical trials. And so ensuring that communities have access to this information beyond just sort of what the protocol says is really critical, and that these access points for education create an opportunity for us to elevate and increase the literacy and understanding of key community groups and community leaders who often serve as the trusted voices of potential participants. So when you think about, for example, if you were interested in joining, any clinical trial, you would probably have a conversation with, colleagues, friends, family members. And so a lot of our work is also centered on ensuring that those people that you would have access to, that you would talk to about this very important decision, have accurate information to inform your process. We're also launching a faith initiative that is being led by Reverend Edwin Sanders. And this will involve quite a few different pieces, including an advisory council, the implementation of a faith-focused education program that is going to be framed and underpinned by principles relating to anti-racism, anti-xenophobia, anti-homophobia, and good participatory practice, and that these programs will work across different faith groups and racial ethnic identities. That we're going to employ faith ambassadors who are going to be distributed geographically around the U.S., who are going to work to mobilize faith communities in their area and really speak to the intersection of faith and science, and to establish networks of faith leaders around the country and work with established networks of faith leaders around the country in support of education around COVID and education activities around the trials. Clergy consultants who will support these efforts by hosting meetings and convening consultations in regions around the country, culturally specific education materials, and deploying community mobilization models through this faith initiative that are going to be really impactful and important to bring everyone together and increase partnership opportunities. So these are on the left, many of our critical and sort of priority populations. And I think it's important, and sort of goes without saying, that engagement of these groups and other groups is going to be critical to this process, and not just, again, for the recruitment piece, but also for education, ensuring that people have accurate information, and we can sort of combat the proliferation of misinformation and myths that are in our communities. And this is a slide that simply displays sort of our partnership model, and thinking that we're doing a lot of this work at the national level, and how we're sort of drilling it down also to the community individual level. In partnership with the clinical trial sites, we're going to be doing the recruitment, but also through many of the local organizations that we plan to work with, and regional organizations that we plan to partner with. And that this is important to sort of provide a broad range of ways that people can access information and really interact with this information, that I think is going to be really important. These are some of the communications tools that are being developed, including specific and focused messaging to key populations, and really focusing our media efforts on specific audiences, leveraging trusted voices and champions, engaging in public service announcements, and utilizing key spokespeople, particularly in the faith community. Planning to also do quite a bit of advertising, radio, news, social sites, local levels, as well as national level, and of course, utilizing social media. So this is actually the last slide, and just shows the COVID Prevention Network website, www.coronaviruspreventionnetwork.org. And for folks who have questions about community engagement, please feel free to utilize this email address here to reach the community engagement team for the CoVPN, who can provide more information. If you have questions about stakeholder engagement, that you can feel free to reach out to me. Thank you very much for your time.
Thank you, Stefan. I really appreciate that. So what we'd like people to do now is go to the question section in the GoToWebinar control panel. And in that section, if you could write your question that you might have about this. And while we're waiting, Stefan, I'm going to ask you a few questions myself, because like everybody on this call, I have a lot of interest. So for a community-based HIV organization right now, what is the one thing that they could do to support this effort?
I think having conversations, engaging in conversations with their program participants, their consumers, and their communities, their local communities, having conversations about these, about the CoVPN, about the trials, sharing information and materials, but also if they're hearing concerns, if they're hearing questions and such in the community, particularly from their members, to feel free to share that information with us as well. This is an opportunity to also hear from communities.
Yeah, speaking of that, one of the things that I've noticed is that there is a great medical mistrust by many communities, but particularly communities of color. How are we going to overcome that mistrust in order to vaccinate the numbers that we need to vaccinate?
Yeah, this is a much larger conversation, I think, and medical mistrust is an issue in many communities, and I think it's the response is sort of multi-tiered. I think part of the response is, again, providing accurate information to communities about what's happening, and using trusted voices to support the messages and education in communities. But also ensuring that there are open doors for communities to ask questions, to think about what all of this means, and to understand that that joining any clinical trial may not be for you, and that this is really a voluntary experience, and having excuse me, an opportunity to really ask the critical questions that are needed before you decide to join. And even after you decide to join, of the site staff that you might engage, it's going to be really critical. Our clinical trial sites go through a pretty extensive informed consent process that explains all of the rights that participants have, including, you can leave the study at any time for any reason, and it won't, negatively impact you. No one will think any less of you or anything like that. And I think, conveying those messages is really important. At a macro level, I think that we all need to work collectively, including with our government partners, to support scientific literacy initiatives that are going to really help to change the conversation around medical mistrust. There have been a lot of initiatives and policy advances since many of those research mishaps and events in the past. The Declaration of Helsinki and the Belmont Report, and clinical trial sites and research units are now obligated to have institutional review boards that are put in place to protect the rights of participants. There are data safety monitoring boards now in place that protect participants as well, and have the ability to stop studies if they see that participants are being harmed or potentially could be put in harm's way. So there are quite a few things that are in place, and I think it's really important for us to talk about that.
Thank you. Yeah, and I think that I look forward to having all of the different pieces that you have to educate folks online so that we can download it. I'm going to ask one more question, and I know that there are a lot of people who have questions, but this final question is, in terms of the trials, if you were a person living with HIV, would you enroll in one of the trials?
Well, if I weren't working for the network. If I weren't working for the network, then I would absolutely consider joining. Each of the studies has, its separate and distinct sort of inclusion criteria, exclusion criteria. So it's important to really look at what that means for you and decide whether or not this particular study, the Moderna trial, or any of the other trials, AstraZeneca, Janssen, or any of the others would be appropriate for you. And I think that that's a conversation that people should have with their primary care physician, if they have one, their families, their trusted, voices, their pastor. But I guess the short answer to your question is, if I wasn't with the COVID Prevention Network as staff, that I would absolutely consider joining.
Great, thank you. So Chip, can you start asking some of the questions from the audience?
Absolutely. The first question we have is Puerto Rico network.
I'm sorry, you're breaking up, Chip. I can't hear you right now.
So sorry, can you hear me now?
Yes.
Okay, so the first question is Puerto Rico included in the network?
It is. It's on the map. It was one of the sites.
Yeah, I remember it being discussed, and I think just for context, again, those sites are the code VPN sites, and they may not necessarily represent all of the sites that will participate in all of the trials. So, but by virtue of them being on that map, they will participate in at least one of the trials for sure.
Next question, Chip.
Sure. I don't see any CBOs attached to pushing the trials. Where have you included CBO into the construction of these trials?
Community-based organizations are largely, I think, not considered clinical research sites. So there's a process by which a clinical or a community-based organization, or rather, let me back up. There is a process by which a research institution needs to go through in order to become a clinical trial site that's funded by the Division of AIDS and the National Institutes of Allergy and Infectious Disease, who is sponsoring the COVID-PN's engagement in this process. And so, CBOs, and by and large, in my understanding, don't have clinical capacity to run clinical trials. So I think that's the barrier there. And there are organizations, if there are organizations that are interested in partnering with clinical trial sites to provide education to their communities, I think that's a really good link.
Chip, next question.
Is there any official statement or information regarding PrEP medication or HIV medication helping on COVID-19 diagnoses?
Ooh, ooh.
I do not have any information about that at the moment. Can you repeat that question?
Sure. Is there any official statement or information regarding PrEP medication or HIV medication helping with COVID-19 positive diagnoses?
So nothing official from the CoVPN. Um, uh, yeah, nothing official from the CoVPN. I'm sorry, I was making a note of that. That's a really good question. Nothing official from the CoVPN.
Great. Next question, Chip.
Sure. Do you think the population that's more affected will continue growing because of how things are going?
That is an interesting question. It's uncertain how things are going to go. I think many folks speculate that the number of cases will continue to rise. Um, and I think that's large in part based on where you live geographically, what physical distancing and precautions are being taken by the person, by the individual people, by the folks in in households, as well as what the local health authorities have put in place regarding physical distancing and protection measures. So it's a layered sort of response. But ultimately, I think many people are looking at cases going up because many of these measures are not working universally.
I'm going to just do a follow-up question on that one, because there was something on the news yesterday about a man who got reinfected and had developed antibodies, but then the antibodies went away. What do we need to know about that, and how concerned should we be?
I don't have any information, to be honest with you, about potential reinfection. And to be perfectly frank, nothing in the literature has suggested, nothing that I've read has suggested that once a person acquires SARS-CoV-2, that they are then protected for life. And I think that sort of confirmation of immunity is what people assume is the case based on their experience with other viruses. But that confirmation hasn't been provided or validated for SARS-CoV-2. So I wouldn't assume that at all.
Thank you. Next question, Chip.
Sure. With HIV lessons learned, potential use of antiretroviral therapies, are HIV and COVID co-infected individuals being represented and data used in clinical trials?
I'm sorry, repeat the question.
Sure. With HIV lessons learned and the potential use of antiretroviral therapies, are HIV and COVID co-infected individuals being represented and data used in clinical trials?
I'm not sure, honestly. I'm not sure what the percentage of persons living with HIV in earlier phase studies for these vaccine candidates look like. And again, each of these vaccine trials, the phase 3 studies that I referenced in my presentation, will have individualized inclusion-exclusion criteria that folks should engage the clinical trial sites to determine what is the most appropriate study for them to participate in.
Next question, Chip.
What is the risk of HIV positive clients participating in the trials?
I'm not sure that I understand the question.
I think the question is there any additional risk that people living with HIV should be concerned about when they think about being a part of a trial?
I would say not any more than anyone else. Yeah, I would say not any more risk than anyone else in the study.
Great. Chip.
Mary Miller said there's a new study that just came out in the Annals of Internal Medicine about that, called Incidence and Severity of COVID-19 in HIV positive persons receiving antiretroviral therapy. So apparently there is a new study that's come out. It's just come out about that.
Does she know what it said? I would be curious about what it said. If she could let us know, that'd be great. But why don't we move on to the next question? Maybe she can write the answer on the screen for us.
Sure.
So,
Sure. If someone is seen by a physician at a CBO, how can they get into the study if they want to?
If a person is interested in the study, I think one of the quickest ways to sort of be considered is to go to the website, www.coronaviruspreventionnetwork.org, and click on the Volunteer Now link to input your information in the registry. A clinical trial site will follow up with you and do a pre-screener and assess your eligibility to participate in the studies.
next question, Chip.
Will antiretroviral therapy medication skew the trial results?
Oh,
I don't have any information about that.
that's interesting. There was a piece in today's New York Times that looked at ritonavir and found that it wasn't particularly effective. So it'll be interesting to see if they have to use it as an exclusionary category. Next question, Chip.
Sure. Mary Miller just responded on that around that study, and she said that HIV positive persons on antiretroviral therapy, specifically TDF or FTC, have a lower risk for COVID-19 and related hospitalizations than those receiving other therapies. It's a Spanish study. She said it's a Spanish study. Take it with a grain of salt for U.S. population.
Yeah, I think it's important to consider the sample size as well.
Yeah. Great. Thank you, Mary. I appreciate that information. Next question, please.
Are there on-the-ground social media, social networking, and other strategies for engaging the younger population?
Many of the strategies that I highlighted on the communications toolkit slide will include digital advertising and social media website engagement. The youngest that persons that are eligible for any of these trials is 18. So just to sort of contextualize that.
Great. Next question, Chip.
We don't have any other questions at the moment, but I did want to point out to everyone that you can download an FAQ on the Prevention Network in the handout section of your control panel. So there is an FAQ that you can download for some general information. At the moment, there aren't any additional questions.
Great. Well, what I'll do is I'll ask a couple more questions, and then if we don't, we can wrap up a little early. And I want to thank you, Stefan. But a couple more questions. If you could once again name the site where people need to go if they want to volunteer or consider volunteering to be a part of the vaccine trials.
Sure. www.coronaviruspreventionnetwork.org. And there they can get information about all the different phases of the studies. It's a full service education website that also provides a link for the registry if people are interested in volunteering.
And have they started enrollment for the Moderna study?
Yeah, the Moderna study has not started enrollment yet.
Okay. Because that's going to be the first one, right? I thought I saw on the screen.
It will be the first one. And then people can also check out clinicaltrials.gov for updates on these studies as well. That's an option.
Great. And as you are looking at moving forward in this, and we look at timeframes, for those of us who don't understand vaccine development very well, kind of what are the timeframes around something like this? First, to get a vaccine, but probably equally important to be able to roll out a vaccine to the billions of people around the world who will need it.
Yeah, the timeline for traditional vaccine development is about a decade. So we are sort of collapsing or condensing many of these pieces, sort of stacking them on top of each other in order to streamline and harmonize and get us to a place where we would have one quicker, because we can't wait 10 years for this, obviously. And then, the rollout for this is really being handled by other partners, the CDC. So that is.
Oh, CDC's doing the rollout. Okay, well, that's good. Maybe we can schedule a call with them. Well, Chip, any more questions?
Yeah, several.
Okay.
We have multiple patients who are HIV positive who came out positive on COVID-19, and they all had few symptoms in comparison with those who are not just taking retroviral medications for HIV, just FYI. Let's see. Could you talk a little about expected efficacy of COVID vaccines?
Well, the studies are powered to look at a vaccine efficacy of about 60%. So that's what I can say at this point.
And I'll just follow up on that one quickly, because once again, what do we need to get herd immunity?
I don't have a model to sort of describe, because I think that is a modeling exercise in general to respond effectively. But generally, I would think that we would need to vaccinate a significant enough people that it would offer protection for other people. You know, of course, you understand herd immunity, the idea that we can vaccinate enough people in the community that other people become protected because the disease or virus of interest can't move through the community as quickly or at all. So what that percentage is, I can't say at this very moment.
Chip?
Are we assuring community representation across all demographics to be inclusive of women, seniors, transgender, Latinx, and so forth? Are they involved in the protocol development and in the creation of informed consent? And will the data be broken down across these subpopulations?
Communities are involved in the implementation and engagement of the activities that I've mentioned, and that will happen at the site level. Communities are not and have not been involved in the protocol design. This has largely been led by pharmaceutical companies to sort of expedite this process.
I do wonder, will they be collecting data on the transgender community?
That's a good question. I can say that it's typical for our process, and I need to connect with some of our folks in the Statistical Data Management Center, but it's typical for our process to collect sex assigned at birth and current gender identity in order to differentiate persons of trans experience versus cisgender persons. So we will be looking at demographics throughout each of these studies in order to look at how they're enrolling, how they're performing in terms of diversity as well.
Great, thank you. Chip, any other questions?
We have 3 or 4 more. Well, I have a little bit more than that. Maybe about half a dozen more. Maybe not for this audience, but is there a curriculum for participating in clinical trials who they'll be new to it? Maybe one that can be shared on the site.
A curriculum for persons who are interested in participating in clinical research.
But may not have before.
Sure. So the website that I mentioned offers a lot of information for folks who are brand new to clinical trials. Again, it covers everything from the different phases of clinical research to the different vaccine and monoclonal antibody development processes, FAQs, risk. It's quite a bit. I wouldn't characterize it as a curriculum, but definitely I think it's a clinical trials 101, if you will. So I definitely think checking out the Coronavirus Prevention Network.org website will provide you with quite a bit of information.
Chip?
Are any of these studies challenge studies of exposed subjects to the virus to help speed up the evaluation of protection?
No, none of them are challenge studies.
I don't even know what a challenge study is. What is a challenge study?
A challenge study is where we would give someone the virus of interest and assess how it moves through the body and how it responds to treatment, or So none of these studies are challenge studies.
Chip?
I'm hearing a lot of concern in the community about trusting any vaccine that has not had a long amount of testing time, especially for anyone who is immune compromised. How do you recommend answering this concern?
I don't know that I have an answer. I have a perspective. I think people should weigh their the decisional process to participate in a study against, their life circumstances. Again, volunteering for any clinical trial is a voluntary process, and it should be seen as such. There is obviously a pandemic that is upon us that is impacting lots of different people around the world. The numbers in many jurisdictions here in this country continue to rise. So I think part of the question is, what is your risk profile? How, what does this mean for your life? And does it make sense for you to participate? And these are questions that I can't answer for anyone. They have to sort of answer these for themselves and think about this again, what it means for them in their life. I definitely recommend talking to your primary care physician about participation if you're interested, and really talking to other people that are trusted sources of guidance for you.
Chip, any more?
Yes, two more. Is this a live virus composed of plasma from a person that has the antibodies, or based on previous type SARS viruses?
These are laboratory manufactured pieces of proteins found on the virus. So it's not a live virus. It's not even the whole virus. Great question.
Final question, Chip.
Sure. Just one note, we just included in the chat box a link to some slides can be used for training on understanding clinical research. So if you have questions, I would check out that link in the chat box. Final question, related to vaccine efficacy, what is the actual trial endpoint? Preventing getting the virus or delaying disease progression?
I think the endpoints include both. I think we want to look at whether people acquire SARS-CoV-2, but also how the virus evolves or not, and the symptomology associated with that. So each of the studies will have, again, each of the trials will have its own protocol. So this isn't one particular trial that we're discussing. Each of the 5 different vaccine studies will be its own study, and will have its own protocol, its own research questions. But in general, I will say that I think it's of scientific interest we find out not just whether it protects, but also to what degree.
Well, first of
and we've had
all,
one. Oh, Paul, I'm sorry, I have one more question, and a very important one. Participating is voluntary, but are there any incentives offered to participate?
Yes, participants will be compensated for their time.
Great. Well, once again, I want to really thank Stefan for a very informative webinar. For all the people who are on, as soon as the screen clicks off, you'll get an evaluation form. Please fill out that evaluation form. Be as honest as possible, because we are trying to figure out how we are learning about this new tool called webinars and how we can do them better. And so we really appreciate everybody being here. Remember that USCHA abstracts are due tomorrow, and we really want you to submit abstracts. And thank you once again to Stefan, and thank you to everybody for being here today. We will talk again soon.
Thank you. Take care, everyone.